Sickle cell disease remains a major public health challenge in Ghana, with over 18,000 newborns diagnosed each year. Stakeholders are calling for greater emphasis on newborn screening services across the country.
Research suggests that 1 in every 4 Ghanaians, representing about 25% of the population, is carrying the sickle cell gene. Kwiku Kwaten Yeboah has been battling the condition for over 45 years. He has concerns about the disease management in the country.
Living with sickle cell is not an easy thing at all. Government has done well to put us on the medication, which is the IV which is mostly available on the national health insurance. But sometimes you don't get it. It's not stocked in our hospitals and it's stocked in private pharmacies, and so we are still having to pay for it.
Kwiku is married with 3 children and wants the government to focus more on preventive measures.
It was intentional finding somebody who would say yes to you, and then somebody who has the gene type to combine my sickle cell gene type so that I give birth to carriers. Most people who are carriers do not know that they are carriers. Test before they fall in love. When you are going into the first relationship, one of the things you should ask is, what is your gene type? Not what is your blood type.
In a bid to improve the overall outcomes for patients with sickle cell disease, the government has launched a national sickle cell strategy. The strategy aims to strengthen preventive measures and reinforce genetic counseling in hospitals, communities, and churches.
Now we have a strategy which will ensure that hopefully if we do things right, every newborn will get to know the sickle cell status. And then once you know the sickle cell status, you're able to link to care. Now the person or individual knows their status, and we prevent the next child from being born with sickle cell disease.
The churches are the people, when they are ready to go marry, they tell them to go and check all these diseases, including sickle cell, when they see that they have sickle cell, they tell them you can't marry. Is it at the right time? It's not, it's wrong. If they are in love, they will marry and have the children and they will suffer.
Technical advisor to the health minister, Dr. Darius Osei, entreated all stakeholders to align their interventions with the national strategy.
Implementing these policies will require our continued collaboration, resource mobilization, a commitment to reaching every Ghanaian affected by sickle cell and vaccine preventable disease in Ghana.
Sickle cell disease is a genetic disorder that affects hemoglobin production, causing red blood cells to become misshapen and break down. It affects approximately 20 million people worldwide and is the most common genetic disorder in Africa.